any of your listeners who might have experienced this or like nodding their heads, because this, the old recommendation of like calories in, calories out does not apply to people with PCOS. And if anything, most of them, by the time they reach me, have tried a lot of different diets, including calorie restriction and, exercising for hours a day, and they end up getting really burnt out. Well, what other factors here are influencing their insulin resistance or their inflammation, kind of on a spectrum of there are people who have PCOS and are lean. So just looking at someone, you can't look at someone and say, well, that person doesn't have PCOS, they're too thin. Like that doesn't apply. But there are certain people who have a much harder time with losing weight, or they're the ones who are saying, like, I don't get it. Like I eat perfectly clean, I exercise every single day, and I just won't budge. And my partner is sitting over there doing the same thing as me and has lost 20 pounds in a month.
What's something that you wish men knew about women's bodies that we do not seem to get?
There's so many, you just have to pick one. So my name is Dr. Katie Rose. I'm a licensed naturopathic physician. I practice in Arizona, and I also provide fertility coaching nationwide. I came to this work because I had a lot of health issues in college that just didn't add up. I think I was one of those people who on the outside looked really healthy, and so I was judged as being so, even though I was getting frequent lung infections, frequent urinary tract infections, and there was this like running joke at my doctor's office that you should just have your own parking spot here because you're here all the time. Like, that's not funny. I'm like 20 years old. So eventually someone referred me to a naturopathic physician, and I didn't know what that was, to be quite honest, even though I was pursuing pre-med as my undergraduate degree. And I took my time in going to see someone because there wasn't a lot of information. This was at this point 15 years ago.
Mm-hmm.
And when I finally did, it really opened my eyes to what had been missing in my medical care up to this point. Someone was finally asking me, what do I eat? How do I sleep? What are the major stressors in my life? And giving me more tools to address this holistically versus just, here is a drug, take this for this many days, come back if you need us. And it really opened my eyes to what options were available that had never been given before. And I decided to pursue naturopathic medicine as my career. And when I came out of school, realized like we have this huge gap in care for conditions like PCOS and infertility, where there's a lot of misunderstanding, especially about PCOS. It's not something that even some gynecologists are unfortunately like very well trained in like the lifestyle pieces that can make a big difference. And so I chose to focus my practice primarily on PCOS, fertility concerns, and thyroid issues because there's so much overlap between those.
Interesting. So I personally am just learning about PCOS and what it means and how it affects women. For someone who has never heard of it, what would you tell them PCOS is?
So PCOS stands for polycystic ovarian syndrome. Kind of a horribly named condition because the cysts that are on the ovaries aren't true cysts. They're actually considered just resting follicles. So it's a condition that affects the ovaries in such a way that they can be enlarged with multiple follicles, none of which really reach ovulation very well. So what we often see is missed periods or really long cycles. So women will go, 40 or more days without having a period at a time. There are a lot of systemic features to PCOS. So concerns like weight gain, hair growth where we don't want it. So something called hirsutism. So we see like chin hairs or hairs on the chest or the belly. Oftentimes we'll see hair loss on the scalp also as a result of excess testosterone levels. And it can have other systemic effects like higher blood pressure, higher cholesterol, higher blood sugars. And so it does put women with PCOS at greater risk of developing conditions like diabetes and heart disease.
So is it a thing that you are born with, or does it develop in some women and then go away? Is it chronic?
It is chronic. It is something that we need a lot more studies and
Hmm.
research backing, but there does seem to be a strong genetic connection. They have identified a couple different genes that are associated with the likelihood of developing PCOS.
Hmm.
And if you have a direct family member, a mother, a sister, aunt, cousin who have PCOS, there is a stronger likelihood that a woman might experience that too, or a person with ovaries. And there's no, like, it doesn't just go away. There's not a cure for PCOS. However, there are lifestyle factors, eating in a way that balances blood sugar more effectively, for example, lowering inflammation, where we can see a resolution of symptoms in some people.
I see.
But
Got
it's not something that just goes away with a drug or with saying, oh, just stop eating sugar and your PCOS will go away. Carbohydrates or eating sugar does not cause PCOS, but it may make the symptoms worse.
Got you. I see. Understood. So, is there a drug? Are doctors treating this with drugs, or are they just directing them?
There are some drugs that do address some features of PCOS. So the most common scenario that you will see in a woman who is not trying to get pregnant who has PCOS, if they have long irregular cycles, is they'll be given the option to be on birth control of some form of hormonal birth control, which will then like regulate their cycles, and it will cause them to have a normal bleed. But again, it's not curing the PCOS per se.
Gotcha.
It might be a good choice for some women because it helps support the hair features. So it may reduce the hirsutism. It may allow their hair to grow back. It may suppress the cystic acne. So it can make someone's quality of life a lot better. But it doesn't cure issues or deal with issues like the high blood sugars or the insulin resistance that often come with it. So there may also be a drug that manages insulin resistance, like metformin, that gets layered in.
Okay.
Unfortunately, metformin also has a lot of side effects, so not all women tolerate that medication well.
How intense are those side effects?
It depends on the person. So the main concerns with metformin are GI complaints. So, people are having to run to the bathroom every hour. That's not really conducive to good quality of life. That's the most common complaint. But it's not everyone. And I think it's helpful for people to be counseled on the fact that what you eat can also affect how intense those side effects with metformin are.
Right.
So if you are tending towards more vegetables, higher fiber foods, good quality proteins versus highly processed foods, you're less likely to have those side effects too.
I see. You mentioned pregnancy. So does PCOS make it more difficult for women to get pregnant?
It can, in the sense that if a woman is not ovulating regularly, it will decrease the chances each cycle that she could get pregnant. So in any given cycle, a woman who's ovulating every month has about a 20% chance of conceiving if she's having intercourse during that fertile window.
Right.
And if someone is not ovulating, obviously, you're not going to conceive if you're not ovulating. So we've got to get people with PCOS more opportunities for more ovulation, and that can increase their chances of getting pregnant.
Got you. So for women trying to get pregnant, do you have any tips for them to make it more likely? Or what kind of things impact fertility for women?
Yeah. So for the general population, the things that affect fertility for women are your hormone levels. So hormones like progesterone, which are only produced after ovulation and help maintain early pregnancy. Thyroid levels, which again help to regulate really every step of the fertility journey, from ovulation to implantation to early pregnancy growth. And there's all these little other features that influence those too. So your blood sugar levels, inflammation, the microbiome, nutrient deficiencies. And so there's a lot of overlap between the general population who might be trying to conceive and women with PCOS. And for people with PCOS, like those might just be a lot of heightened issues. So the inflammation, the insulin resistance, the nutrient deficiencies, and the possibility of having thyroid issues are just much higher chances in that population having these concerns. So these general recommendations, making sure that your vitamin D levels are optimized and your inflammation has been checked and you're doing things in your lifestyle that support inflammation. That's for everyone. Everyone can be giving some good positive focus on those.
Right. Okay, cool. Good to know. So we know menstrual cycles can vary a lot for women. At what point is it not normal and they should seek medical advice?
So the normal cycle is considered to be anything from 21 to 35 days in between periods. And that's denoted from the first day of one period to the first day of the next period. So I think it's important for people to actually understand that timing too.
Right.
And it's not from the end of a period to the first day of the next period. It's the first day of your cycle that we're calculating this from. Yep. So anything shorter than 21 days and anything longer than 35 days.
Gotcha.
Would be important to have evaluation for.
I know there is this relationship between PCOS and weight management. Is it that PCOS makes it difficult for women to lose weight or makes it easier for them to gain weight? What's that relationship like?
It's both. It's really both. And I think any of your listeners who might have experienced this are nodding their heads because this, the old recommendation of calories in, calories out does not apply to people with PCOS. And if anything, most of them, by the time they reach me, have tried a lot of different diets, including calorie restriction and exercising for hours a day. And they end up getting really burnt out on that because it doesn't work. And so when we start to look at the whole person, well, what other factors here are influencing their insulin resistance or their inflammation? We can usually make sure they're eating more and in a ratio of macronutrients that's really designed for the individual person so that their body can start to regulate weight more easily. But it is unfortunately a feature for a lot of women with PCOS. It's not everyone. It's, kind of on a spectrum. There are people who have PCOS and are lean. Just looking at someone, you can't look at someone and say, well, that person doesn't have PCOS. They're too thin. That doesn't apply. But there are certain people who have a much harder time with losing weight, or they're the ones who are saying, I don't get it. I eat perfectly clean. I exercise every single day and it just won't budge. And my partner is sitting over there doing the same thing as me and has lost 20 pounds in a month.
So it's the types of food that they're eating that is usually the issue, right?
It can be the types of food. And again, there's this genetic predisposition. So they've got these genes that are turned on that send this constant signal to store fat and to, store calories in such a way that someone who does not have PCOS won't have that same signal happening. So the timing of how someone eats, the quality of the food, the ratio of protein and fat and carbohydrates can make a really big difference for some people.
What's something that you wish men knew about women's bodies that we just do not seem to get?
There's so many, I just have one. I think for the purposes of this conversation, just understanding that women are cyclical beings.
Cyclical beings.
We are cyclical beings. So we've got these monthly, hopefully, things are working pretty well. We've got these monthly cycles, right? And our energy, our caloric needs, our emotional capacity can all change throughout the cycle.
But you're saying it will change back at another point in the cycle.
Yes, it could. So a joke that I've made is my follicular self. In the follicular phase, most women will tend to have more energy, more creativity, feel more outgoing. If my follicular self makes way too many plans and my luteal phase self is the one who's well, you scheduled this, but I don't want to go to this now.
I've never heard those terms. That follicular
So
phase.
there's what we can divide the cycles into either 2 or 4 phases. And for the purpose of this conversation, we'll stick to 2. So the follicular phase is from the first day of the period until ovulation. And that varies quite a bit. So someone with PCOS, their follicular phase might be really long.
Mm-hmm.
The luteal phase is the phase from ovulation until the period starts. And that phase is usually 10 to 14 days. It does not vary very much.
Gotcha.
And so that follicular phase tends to be like higher energy, a little more creativity, feeling more outgoing, more likely to want to engage, want to schedule dates and plan parties. And then luteal phase is more of like, someone might stereotypically think about like PMS, like, yeah, I just want to like hole up with my Netflix and like my chocolate, and like not human with the people so much. So yeah, that's something to just, be aware that like these cyclical changes do have effects. And if we have the awareness and we can plan around them, it can make life a little easier.
I honestly never knew that. Well, I mean, I knew about PMS, but you definitely opened up my eyes a little bit to
I'm so happy to do that.
what women are going through. Great. So, anything that you think people, because again, it's kind of a new condition, or at least new term for the condition, people with PCOS or people who suspect they have PCOS should know how they should go about starting the conversation with their doctor. When it's just wondering if something is wrong, what would you suggest that they do?
Don't be afraid to ask questions. I know that sometimes it can feel really intimidating to ask doctors a lot of questions if they've already kind of like tried to shut the conversation down.
Mm-hmm.
And so remembering that at the end of the day, doctors are working for you, even if they may be in an authority position. So don't be afraid to ask questions. I would have a list of questions to ask so that you don't go into your appointments feeling really frozen, which can happen even to the best of us who've been in this world for a decade. And don't be afraid to ask for referrals if you feel like your questions aren't getting answered or your needs are not being met. Like, don't be afraid of being the quote unquote like problem patient, the annoying patient, or the one who's like, oh, I'm asking for too much. Like, for the most part, most of my patients who have felt that way are not getting their needs met because they are not asking for their needs to be met.
I see.
So if you're feeling like something is off, I've read enough about this to know that it's not normal for my period to be skipped every other month. And this doctor is just saying, yeah, just take birth control, that you'll be fine. When we know that this is a really complex condition that has far-reaching health implications like diabetes and heart disease, we want to catch the issues in our 20s, 30s, even in our teens if possible, so that we can prevent those issues from progressing.
Mm-hmm.
And this means being more aggressive about the lifestyle pieces, knowing how to feed yourself with nutritious foods. Doesn't mean there's restriction involved. Doesn't mean you have to go keto or no sugar or no carb, like whatever variation of that is non-sustainable. But it means being able to advocate for yourself and recognize that not all doctors are trained equally in this.
Got you. Awesome. And is there anything that we might have missed that you would like to share? We covered a lot of bases.
We covered a lot of bases, and I think it's a great overview. And there is so much that I could talk about PCOS that I could probably spend a whole week on. But there's, I think we got a good starting point.
Well, let the people know how best to find you if they maybe want to request your services. How do people contact you?
So they can contact me on my website. It's drkatierose.com. And as far as social media goes, I am mostly on Instagram, and they can find me at Dr. Katie Rose. And they can shoot me a message directly on Instagram or through my contact page, and either me or my assistant will always reply.